Hey, this is Aaron Wall. I did my presentation on concussions in high school athletics. Some things that will be covered in this presentation. I will talk about what the definition of a concussion is, or what exactly a concussion is. Some statistics dealing with concussions, some current legislation, um, baseline testing, and cover exactly what that is. Some signs and symptoms of concussions and what to look for. What exactly should you do as a coach when you suspect one of your players had a concussion? When can your players resume activity? And go over some of the guidelines for that. Go over any ways that we can prevent concussions and some of the long-term effects of concussions. So first off, what is a concussion? A concussion is a type of traumatic brain injury caused by a blow to the head or body, a fall, or another injury that jars or shakes the brain inside the skull. So your brain is actually hitting your skull when it shakes around in there. Some people believe that it is a bruise to the brain. Bruising of the brain can happen, but with a concussion, it is not bruising the brain. It's rather a traumatic injury to the brain. Some statistics about concussions. 400,000 brain concussions occurred in high school athletics during the 2008-2009 school year. 16% of football players who sustain a concussion severe enough to cause loss of consciousness return to play the same day. And that's kind of a scary statistic, thinking that they had a concussion and they're back in the game the exact same day. Emergency room visits for concussions sustained during organized team sports doubled among 8 to 13-year-olds between 1997 and 2007 and nearly tripled among older youth. Concussion rates more than doubled among students aged 8 to 19 participating in sports like basketball, soccer, and football between 1997 and 2007. And during that time, participation numbers in those sports declined. So we were seeing an increase in concussion rates, but with a smaller sample size or less participants in those sports. Some more statistics. More than 248,000 children visited hospital emergency departments in 2009 for concussions and other traumatic brain injuries related to sports and recreation. Female high school soccer athletes suffer almost 40% more concussion than males, or around 29,000 annually. And female high school basketball players suffer 240% more concussion than males, and roughly around 13,000. And I couldn't find anything about why that is. I just thought it was interesting that the female rate is higher than males. Some current legislation going on with concussions. We have the Protecting Student Athletes from Concussions Act. This establishes guidelines around prevention, identification, treatment, and management of concussion in school-age children. Requires states to implement concussion safety and management plans that include return-to-play requirements and academic supports. Additionally, the bill requires that any student who suffers concussion be immediately removed from any participation in school sports until he or she receives a written release from a healthcare professional. And a lot of this is just to ensure the safety of the athletes, and some legislators are really taking action in this area. Another one is the Concussion Treatment and Care Tools Act. This national guidelines drawn from the CDC, or Center for Disease Control, work group recommendations on best practice for diagnosis, treatment, and management of a traumatic brain injury in school-age children. And this legislation also provides for grants to help states implement these guidelines. Next is baseline testing. Baseline testing is a preseason exam conducted by a trained healthcare profession. So they take all the students and they get their readings doing the test, or what would be a normal functioning athlete. These tests are used to assess an athlete's balance and brain function, as well as for presence of any concussion symptoms. Baseline testing can be used and compared to a similar exam conducted by a healthcare professional during the season if an athlete has a suspected concussion. So they can take your baseline readings and then do the test again and compare your readings to determine if you have an athlete that has a concussion. Results from baseline testing can be used if an athlete has a suspected concussion. Again, the healthcare professionals can use those to um, determine if you have a concussion. And the baseline testing should be repeated annually to establish a valid test result for comparison. So if that can be done during your health physical and all that other um, required stuff that the athletes have to get done. Some signs and symptoms of concussions may include headache or feeling pressure in the head, temporary loss of consciousness, confusion or feelings as if in a fog, amnesia surrounding the traumatic event. So if they don't remember what happened before the event, if they don't know where they are or what day it is, or what's going on around them, that could be a sign of a concussion. Dizziness, or some people refer to it as seeing stars, some ringing in the ears, nausea, vomiting, slurred speech, delayed response to questions, appearing dazed or fatigued. So if you have an athlete that has a blow to the head, just keep these in mind when you are interacting with them and trying to figure out the severity of the injury. Some symptoms of concussions may be immediate or they can be delayed in onset by hours or days after the injury. Some of these examples are concentration and memory complaints, irritability and other personality changes, sensitivity to light and noise, sleep disturbances, psychological adjustment problems, and depression, or disorders of taste and smell. So even though they might seem okay after the blow, some of these can come on in the days after the blow happens. So what should we do when you suspect an athlete has a concussion? The first thing that you need to do is remove the athlete from play immediately. After that, you ensure the athlete is evaluated by a healthcare professional experienced in evaluating concussions. You also need to inform the athlete's parents or guardians about the possibility of a concussion. This is very important that you communicate that and tell them exactly what happened during the event. You also need to make sure that you keep the athlete out of play the day of the injury and until a healthcare professional says it's okay for the athlete to return. So just because they say they're okay until you have written clearance from a healthcare professional, then that athlete should not be allowed to play. Which brings us to our next point. When should the athlete resume play? And there's a lot of debate among this about when they should be able to come back and play. So there's no internationally agreed consensus on advice about when it's safe to return to play. But the 2008 Conference of Experts in Sports Medicine recommend the following steps. The first is complete rest until symptoms have passed, so they should not be doing any things until those symptoms we talked about earlier have subsided. After that, they can go on to light aerobic exercise such as walking and cycling. After they can do those with no symptoms, they go to a sport-specific exercise such as running drills for football or rugby. Any of these activities should not include any impact to the head. When they can do that without any symptoms, they have a non-contact training such as passing drills for football. Next step would be full training, including physical contact such as tackling. And after they complete that step, then they are cleared to return to play. With these, each step should take about 24 hours. So if you're symptom-free, you should be able to return to play within a week. If you experience a return of symptoms, rest for 24 hours, and then you need to drop down to the previous step and then attempt to move up again. So if we complete step 1, we go to step 2, they rest for 24 hours, and then they would go back to step 1. Some things, if players return to play too early, they could suffer what we call second impact syndrome, and that is a very rare condition in which a second concussion occurs before a first concussion has properly healed. This causes rapid and severe brain swelling, and it often results in death. Um, True second impact syndrome involves brain herniation and death, usually within minutes. So this is a very, very severe thing. This is why it's important that we don't return athletes sooner than they should. A patient who is suspected of suffering from SIS should immediately be stabilized with special emphasis on airway management. Neurosurgery will also be considered depending on the severity of the injuries, and in cases where SIS isn't fatal, the long-term effects will likely be similar to those of severe traumatic brain injury. So it's pretty serious and very important that we are taking the right steps and making sure these athletes are cleared before they return to play. Some things we can do to prevent concussions from happening. Some things we can do during the preseason. We need to ensure that that we have a concussion policy in place. It's important that they are aware that there is a concussion policy in place, and all the coaches need to be aware of that. The second thing is to have a concussion action plan in place before the season starts. This is included in the district policy, so you need to review that and know exactly what is going to happen if there is a concussion. Third, we need to educate athletes and parents about concussions. Before the first practice, talk to athletes and parents and other coaches about the dangers of a concussion and potential long-term consequences of the concussion. You need to explain your concerns about concussions and expectations of safe play. Remind athletes to tell coaching staff immediately if they are feeling any symptoms of a concussion. And last, you need to monitor the health of your athletes. Make sure to ask if an athlete ever had a concussion, and insist your athletes are medically evaluated and are in good condition to participate. During the season, you need to insist that safety comes first. You need to teach and practice safe playing techniques to prevent concussions, and encourage athletes to follow the rules and play to practice good sportsmanship at all times. Teach athletes it's not safe to play with a concussion, so that goes back to educating the players and what could happen, and prevent long-term problems. If an athlete have a concussion, they need time to heal, so just make sure that you're taking the precautions and not returning them to play earlier than they should. The postseason, you should keep track of concussions. Let's go back here. Keep track of concussions, and then this is a good time to review the policy and action plan. Some long-term effects of concussions. Most people become asymptomatic within a fairly short time period, so that means that they are not showing any symptoms of concussions. 10 to 20% go on to develop chronic problems. Some chronic problems include problems with mood, depression, anxiety, headaches, problems with balance, difficulty with their thinking, and problems paying attention or concentrating. So really, as coaches, you guys are kind of, to wrap up here, you guys are responsible for the students' well-being, and just make sure you're taking these steps to ensure our players' safety, so we can keep them healthy and on the field. If they do happen to have a concussion, I know a lot of times it's out of our hands and accidents do happen. Just make sure we are taking the right steps to getting them back on the field safely, and we don't want to rush that. And here are my resources for this presentation.